And delighted now to welcome Thy Vanem from Oslo, who's going to talk about how we organize multidisciplinary care for patients who have genetic conditions. Thank you for participating.
Hello. Thank you for the invitation and for giving me the opportunity to give a talk. I'm a physiatrist at Oslo University Hospital, and I'm also in the same MSA working group in Vassen as Nina. So today I will talk about multidisciplinary care and rehabilitational patients with HTAD and VEDS in Norway. So I hope you will think it's interesting in other places in the world. I will first just say a few words about the introduction on multidisciplinary aortopathy clinics, and then the background for establishment of such a clinic at our hospital. And then finally, I will say a few words about rehabilitation of patients with HTAD and VEDS in Norway. Yeah, so as you all know, people with HTAD and VEDS have conditions that can affect several organ systems. And you often need to see several different doctors in different specialties. And international guidelines recommend that HTAD should be managed in multidisciplinary aorta clinics. And the main benefit is better diagnostics, better follow-up and treatment for the patients. And we have already established a multidisciplinary clinic for HTAD at Oslo University Hospital, and it's highly thanks to Dr. Kirsten Krogh Sørensen. She's a vascular surgeon at the hospital, and today the clinic is a part of the Department of Cardiothoracic Surgery at Oslo University Hospital. So it started as a project period from 2017 to 2019. And the project was funded by the Norwegian National Advisory Unit on Rare Disorders. And the project was planned and organized by a reference group. And the reference group had representatives from Oslo University Hospital, from TRS, where Nina also works. It's the National Resource Center for Rare Disorders in Norway. And of course, with the patient associations, the Norwegian Muffin Association and the Norwegian EDS Association. And as you can see, there were several departments from Oslo University Hospital involved in planning this project. And in the period from September 2017 to November 2018, a cross-sectional postal questionnaire study of patients' experiences with the health services was conducted. 50 patients from the aortopathy clinic was invited to be in the study group, and 50 patients from usual care was invited to the control group. And as you can see, the mean age in the study group was about 36 years old, and in the control group, they were about 49 years old, so a little bit older. And there were more than 50% women who participated. So women always participate more in these studies. So due to the small groups, we need to be cautious with interpretation of the results. But patients in both groups reported diagnostic delay. And of course, that's not good. And patients in both groups reported high confidence with medical specialists. A larger proportion in the study group experienced good cooperation, good organization, and good counseling. And we have to remember that this was very early in the history of our clinic. So hopefully it is much better today. So this is how we organize the clinic today. Norway has a population of 5.5 million, and we receive referral from all of Norway, both children and adults. And all the patients who get an appointment with our clinic meet to day one. And prior to the consultation, they are referred to the Department of Radiology for imaging with CT or MRI of the aorta and the arteries. And then they come to a 60 minutes consultation. Unfortunately, we don't have very nice facilities. It's a very small room, and we are 5 doctors and a nurse in this small room. And sometimes if there are children coming, they come with their parents, and it's really, really small. But anyway, and after the 60 minutes consultation, they have an echocardiography in another room, also at the same hospital. So after this consultation, they receive a report, and they can choose if we should send it to the GP or other relevant doctors that also do follow-up of these patients. And they receive recommendations on further follow-up after day one. And all the patients are informed about TRS, the National Resource Center for Rare Disorders in Norway, because at this center, you don't need a referral to contact if you have any questions about your condition. And sometimes they also need referral to other relevant specialists, like an orthopedic surgeon, neurologist, ophthalmologist. So it depends on what we discover during the consultation. And if the patients are in need of rehab, they are referred to Lovisenberg Rehabilitering, which is only a few kilometers from here. And a few patients also need to come to a day 2. We started the day 2, I think, in January 2022. Right, Nina? Something like that. Yes, and it depends on the patient's needs. They can see a physiotherapist, a physician, a psychologist, an occupational therapist, or a social worker. And Juan, you asked about follow-up, because the patients can only have this multidisciplinary consultation once, but the clinic is a part of the Department of Cardiothoracic Surgery. So many patients, they are still followed up by the Department of Cardiothoracic Surgery after they have been to the aortopathy clinic. And if, you know, Norway is a small country, but the distances are very far if you come from the north of Norway or the west. And if they live very far away from Oslo, we used to say that maybe they can come every second year so that their local doctors also know about them. It's very important that the local doctors also know the patients, but some patients also prefer to come yearly to follow up. I hope that was answer to your question. And also thanks to Dr. Kirsten Krogh Sørensen, we have established an HTAD register at the clinic where we have different variables. We have data on cardiology, surgery, genetics, phenotype, and we also have new variables concerning pain, physical exercise, and quality of life, and also fatigue in this registry. So our multidisciplinary clinic for HTAD patients, in Norwegian, we call it Bindevevsklinikken. like as you see, we are member of VASN, and we have close cooperation with Lovisenberg Rehabilitering and TRS, National Resource Center. So Nina, she's both places. And we have a national network in Norway. So the results from the multidisciplinary aortopathy clinic by August 2024, I forgot to say that in the beginning, we saw 5 patients per month. We are a small country with few people. And now we see 6 patients once a month. So since 2017 to today, we have seen 373 patients, and we have 372 patients who have consented to be registered in the HTAD register. There are not so many patients who have been to day 2, but there are several reasons for that. So I will say a few words about rehabilitation for this group in Norway. It's Jostein Grimsmo. He's also a physiatrist. He's in charge of this rehabilitation program. So you see, it's located near here. And here are some pictures of the exercise facilities at Lovisenberg Rehabilitering. They have many different professions in their staff: doctors, special nurses in cardiology, physiotherapists, sports therapists, occupational therapists, social workers, psychologists, nutritionists, and bioengineers. So they are well covered. It is a group-based rehabilitation. And from May 2022, Lovisenberg Rehabilitering started the first inpatient specialized rehabilitation group of 8 to 9 patients. And they were mostly Marfan syndrome. And the duration of the rehab is 26 days. And if they don't live far away, they can go home in the weekends. And by the end of this year, Lovisenberg Rehabilitering will have received 7 inpatient rehabilitation groups with 6 to 10 patients in each group. So here is a short description of the program. The rehabilitation program starts with a cardiopulmonal exercise test with specific focus on blood pressure. You have heard blood pressure mentioned many times today. And they use it as guidance for further intensity of physical activity during the stay. So from what I've heard from Jostein, it is very safe to receive rehab there. I don't think they have ever had any events, any cardiovascular events in this group. And the patients are measured with ambulatory blood pressure monitoring during different activities, both endurance and strength training. So it secures the patients that they know, okay, when I do this, when I do the bicycling or this and that, my blood pressure is like this. The patients will, in addition, be measured with 24 hours blood pressure twice and eventually correction of medication. Other aspects of the program will be social support, inclusive vocational guidance, psychological support, lifestyle recommendations, and education about the different aortopathies. So these are in the team and collaborators of our clinic. Thank you very much. This is the tallest mountain in Norway, Galdhøpiggen.
Thank you, Titi. That's very interesting. I'm fascinated by the inpatient rehab. That sounds like a very interesting program. And there's movement towards something called prehab, where patients having elective surgery do prehab. They get their lungs and their heart and their body stronger to recover more quickly after surgery. I haven't heard of that being done for aortic surgery. Is any of that being done here?
Cardiac surgery, I think, but it's been a big thing like in orthopedic surgery. For example, if you want to have a hip replacement and you're smoking, the orthopedic surgeon will say to you, as long as you smoke, no hip.
Yeah.
And like if you do hernia surgery, the same thing. If you don't lose weight, we won't operate on you, because we know that the results after the surgery is bad.
Right.
And if you lose, a certain amount of kilos, the results will be much better. And if you haven't smoked for a few months before your surgery, the
do much better.
Pulmonary complications are gone.
Yeah.
So that, I mean, for example, for elective surgery, that should be a good thing. If
I would think so.
If you have to wait 3 months for surgery. I mean, you have time to optimize yourself.
Yeah. Other questions for TT? Yes, Juan. Microphone coming.
I'm also very interested in the inpatient program. This could never work in the United States under insurance and plans which would never pay for this. But can you give us an example of the kind of candidate? And then it sounds like it's what, 2-3 week program, inpatient?
4 weeks.
4 weeks.
Yes.
And then what are they like at the beginning and what are they like at the end?
If you're asking if we have data on,
or it doesn't have to be that high level of data, but even just a description from your point of view.
What we've heard, the feedback from the patients, they're very, very happy with this rehabilitation because, of course, it's easy to receive recommendations with your doctor. That it's good for you to be active, physical active, and all that. But a lot of patients have given feedback that they feel much more secure in what they can do when they actually see what their blood pressure is during activity, and it is much easier to follow up with activity when you have been in rehab for 4 weeks. And then you know what you can do. And I forgot to tell you that even though this is a group-based rehab program, they can also do individual exercises. They can do yoga, they can go swimming. And like I said, we don't have data yet, but they seem very satisfied with the rehab program. And they learn a lot during these 4 weeks. And what kind of candidate do we have? It's enough that they have the condition. Some of them receive rehab after surgery. Of course, if they don't have any complications. And some receive rehab prior to surgery. It depends. No, I'm sorry, not prior to surgery, but it's not like only patients who have surgery can come to the rehab. If they have a diagnosis and they need to learn more about exercise, Nina, I just have to check with
Well,
Nina.
it's interesting that,
because
we give
it depends on their individual need.
It could be, I mean, after surgery is one thing, but sometimes they could just be very deconditioned.
Yes.
Or they could be scared of moving, or they could have a lot of musculoskeletal pain and find it difficult to find relevant activities. So there can be all kinds of reasons that they need rehabilitation.
Yeah. So it's not like one special candidate. It depends on their needs. And in Norway, it's covered by the government, so we don't need insurance to take care of it.
It's really interesting. I mean, in the US, you would get over 12 weeks, 36 sessions of rehab after surgery. You're doing it 26 sessions, one time, boom, you're just doing it. And my bet is that they're happier and more optimistic and stronger because of it. It's really interesting. Are there other questions? Yes, Nina.
I just want to add that we also have a collaboration with the Rehabilitation Hospital in Germany. And we have learned from them the way they do it and do many of the same things.
So same, yes.
A similar program, yes, based on their experiences.
Wow. This is an example of how much we learn when we move around the world and learn from you. So thank you. Were there other questions or comments for TT? Great presentation, wonderful program. Thank you so much.